Well, this is a fascinating story, a medical miracle. In just 1 year, a brand new vaccine may be available that can cure cancer. Researchers hoping to test it out on humans after 97% of mice with blood tumors were cured. No painful side effects and no chemotherapy. So is this the breakthrough that we have been waiting for? Here to weigh in is family physician Dr. Jen Caudle. Thank you so much for joining us this morning.
Thank you.
So I saw this study came out and I really thought this is amazing if true and will provide so many people such hope because it's like 1.7 million people are diagnosed with new cancer every single year.
You know, the numbers are staggering, and you're right. It's so many people. Approximately 40% of men and women will be diagnosed with a cancer at some time. That's according to the National Cancer Institute. And I can tell you, honestly, as a family physician, I mean, pretty much every patient I've ever had to tell that I've been concerned about cancer or has cancer, I have never forgotten. Yeah. It literally changes people's lives. So this is a breakthrough. So
let's talk specifically about what we're talking about.
That's right.
So this is a study. They used mice, right?
Right.
And they tested it in mice, and it cured 97% of mice. As we said, the human trials might begin next year, and this would replace chemotherapy.
Well, so what we're talking about here is a different way to treat cancer. Okay. They call it a vaccine, but really, I think people refer to it as that because it's an injection. What happened in mice is that two agents were injected into the local tumor environment, and that caused the immune system to become kind of stronger and more aware, which allowed the mice's body, to then be able to see tumor cells throughout the body and be able to fight them. It's the idea of using the body's own immune system to fight cancer. That's the bottom line here. And as you mentioned, what we need is we need human trials, and we need to see how well could this possibly work in people.
So is this just for blood cancers at this point?
Well, interestingly enough, this potentially could be for many different types of cancers.
So like breast cancer, prostate cancer?
Potentially, it could be. Now, we know that this is a tumor-specific type of treatment, meaning so it would work for a specific type of tumor, but the idea is it could potentially work for many different types. There's a lot of questions we still have. It really is considered experimental at this time, but it's very promising as a concept. And again, you know, I've seen some reports saying that human trials may start as soon as in the next year or so. That's going to be very interesting to see.
What does it have to take to get to that point?
So, you know,
the human trials.
You know, you're right. So we often, there's a lot of sort of behind the scenes work that happens when we're talking about bringing a new treatment or therapy to the market. We have to make sure that it works. We have to make sure that it's safe. We have to make sure that it's tested on large numbers of people enough so that we can say to the best of our ability that it is safe and that it does work safe enough, right? So this is where we involve, you know, science in the lab. Then it goes to often to animal trials. We've seen some trials in mice, right? And then, of course, taking it to people and looking at how this may work in individual people and, of course, different types of cancers, et cetera. There's still lots of questions to be answered, but I think it's important to be hopeful.
Absolutely.
Really
I was going to say that. Lots of questions, but still that little bit of hope that we can give people. So
absolutely.
Thank you so much. Appreciate you joining us.
Thank you.
Great to have you with us.